I was invited to give a speech on the pathophysiological mechanism of COVID-19 headache, and everything actually started from a study that we conducted here in our hospital at Vall Hospital during the first wave of the pandemic. So here in Spain, in Barcelona, in March 2020, many neurologists like me had to attend COVID-19 patients as general clinicians. So it was the first way we actually stopped attending patients, neurological patients, and we had to attend COVID-19 patients due to the COVID-19 pandemic. So that was the occasion for us to detect that headache was one of the most bothersome and frequent symptoms in COVID-19 patients. The thing is that usually a headache that is attributed to a viral infection is something that is not well studied by neurologists, because neurologists don't see that in their usual practice, in their outpatient clinics. So this was a unique occasion to study this bothersome and disabling symptom, neurological symptom. So we conducted a study, and in the study we observed that we included 130 patients, and we observed that around 75% of patients had headache, and that patients with headache had more anosmia and ageusia. And also the COVID-19 disease duration was 1 week shorter. So it seemed that the patients with headache had actually a better prognosis. So this is what took us to hypothesize some of the pathophysiological mechanisms underneath this headache type. So the thing that so when we have to study the pathophysiological mechanism of COVID, and to understand the pathophysiological mechanism of COVID-19 headache, we can actually have to take it to consider that there are different aspects. The first one is the virus itself and how the virus interacts with the host. So the immunological mechanism. So there could be immunological mechanisms underlying this headache type. Then we also have to consider the responses that are generated within the host by the infection, and how these responses affect the brain, because in the end we are talking about a neurological symptom. So this is mainly inflammation. And then also we have to consider in order to understand COVID-19 headache, also the relationship between the virus itself and the nervous system, considering that the SARS coronavirus 2 has a neuroinvasive potential, or it has the potential to directly damage the nervous system. So if we consider all these three aspects, then when we consider each one separately, for example, considering immunological mechanisms, it is supposed, we don't know yet, but studies have observed that patients that there are different immunotypes in COVID-19. So these different immunotypes can be related not only to disease severity, but also could reflect some characteristics of the disease, and some of these characteristics could be, for example, headache. So we don't have data right now on which are exactly the immunological mechanisms underlying COVID-19 headache, but if we know that somehow there are different immunotypes, and patients have can activate differently the immunological mechanism, maybe this differential activation or expression of this immunological mechanism can lead, for example, to headache in some patients and to other symptoms to others. So this is the first aspect. Then the second one is inflammation. Considering inflammation, why it is involved, inflammation, because we know that the COVID-19 can generate a huge inflammation, systemic inflammation, And some molecules like interleukin-6 that are involved in the cytokine storms of the COVID-19 also have been observed in the pathophysiological mechanism of some headache disorders such as migraine. For example, interleukin-6 seem to sensitize dural afferents in animal models. So this sensitization leads to a migraine-like behavior. So interleukin-6, it is an hypothesis, may be associated. It's interleukin that is generated in the context of the cytokine storm, but may be involved in neuroinflammation and therefore can activate the trigeminal vascular system, leading to headache. So this is an hypothesis. There are studies that have tried to measure the interleukin-6, but actually there are conflicting results about some patients with headaches seem to have more interleukin-6, while in other studies, patients with headaches seem to have less interleukin-6. So it's something that it's still a matter of debate. And also other molecules can be involved, such as, for example, the CGRP. CGRP is involved in the pathophysiology of migraine, and it is also involved in regulating inflammation in the lungs in COVID-19. So there could be a shared mechanism that can lead to the activation of the trigeminal vascular system, that through a CGRP mechanism, but still it is not clear because the only study that were done on CGRP actually the findings actually between patients with headache and patients without headache are the same. These findings on CGRP levels. So it doesn't seem like patients with more CGRP with headache had more CGRP. This is something that has not been observed yet. And concerning mechanisms that involve the direct damage caused by the coronavirus to the nervous system, it is supposed that the coronavirus 2 is able to produce an inflammation in an endothelitis, an infection of the endothelium. The endothelium is the inner part of a vessel, and specifically it is also present in meningeal vessels. And there, the infection of the virus to this endothelium is able to generate local inflammation that may activate the trigeminal vascular system and therefore leading to headache. So these are mainly the main the pathophysiological pathophysiological pathways so far.